and amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Today's topic is about anticoagulants. Here we discuss about different types of anticoagulants that are used in different color-coded vacutainers. So when collecting blood, we don't want blood to clot, so we use anticoagulants that are present in vitro, that is outside the body. What is an anticoagulant and what does it do? It is more commonly known as blood thinners, and they are chemical substances that prevents coagulation of blood, and also it prolongs the clotting time. Some examples are ethylene diamine tetraacetic acid, heparin, sodium citrate and sodium fluoride. Ethylene diamine tetraacetic acid, that is EDTA. It will be a lavender color vacutainer, and it is also called as sequestrin or versin. The actual salt used here is dry form of dipotassium EDTA, and it is used in a concentration of 1.5 mg per ml of blood, and it is more important to maintain the proportion. Mode of action is chelation of calcium, that is EDTA will grab the calcium from the blood, as calcium is required for activation of coagulating factors like factor 11, factor 10 and factor 2. If EDTA is used in excess, that is more than 2 mg per ml, it will cause some changes like shrinkage and degenerative changes in RBCs and also in WBCs, along with decrease in hematocrit. It also causes swelling and fragmentation of platelets, which further leads to high platelet count. So, EDTA should be used in accurate to prevent error values. Uses: EDTA tubes are used for routine hematological investigations like hemoglobin electrophoresis, hematocrit, cell count and peripheral blood smear. However, these tubes cannot be used for coagulation studies like platelet estimation, as it causes pseudothrombocytopenia. Changes that are occurring due to prolonged storage of blood in EDTA. So, in blood smear, the red cells will show crenation and spirocytic change as displayed in the picture, and in case of neutrophils, it will cause separation of nuclear lobes, loss of granules and vacuoles in cytoplasm. In hematological test, osmotic fragility will increase, total leukocyte and platelet count will decrease progressively. So these are all some changes that occurs due to prolonged storage of blood in EDTA. Heparin. Here we see about in vitro application of heparin, and it will be green color coded vacutainer. Here sodium, lithium, ammonium salt of heparin is used, and these heparinized tubes should not be used for total leukocyte count and for making of blood films, as it shows a blue background. Mode of action: heparin prevents coagulation by enhancing the activity of antithrombin 3, as it inhibits thrombin, and it is used for osmotic fragility test and for immunophenotyping, as it does not alter the size of the cells. TRISODIUM citrate. It will be a blue color vacutainer, and 3.2% of trisodium citrate is used as a salt. So here the proportion varies for different tests, that is, if we have to do coagulation studies, we have to use 1:9 proportion, that is 1 part of anticoagulant in 9 part of blood. And for ESR, 1:4 proportion is always recommended. It is especially used for estimation of erythrocyte sedimentation rate, mainly by Westergren method. So as it is a liquid anticoagulant, it causes dilution, so it cannot be used for blood count. Mode of action. So TRISODIUM citrate acts as an extracorporeal anticoagulant, that is the anticoagulant which is present outside the body. It will bind the free calcium which is present in the blood. No anticoagulant tubes, that is plain tubes. Now sometimes plain tubes are used when there is no anticoagulant is added. It is most commonly used for biochemistry studies, liver function test, which includes total proteins, albumin, aspartate aminotransferase, alanine aminotransferase and bilirubin, renal function test that includes blood urea, nitrogen and creatinine, and also calcium, lipid profile, electrolytes, hormone test and serum osmolarity. These all tests are mostly done without any addition of anticoagulant. Sodium fluoride. It is not an anticoagulant, but it is a special ingredient that is added along with the anticoagulant, mostly with EDTA. So these tubes are mainly used for estimation of blood glucose. 2.5 mg per ml of blood is added and it maintains stable glucose level by inhibiting the glycolysis process. And sodium fluoride is more commonly used along with some anticoagulants like potassium oxalate and EDTA. Color coding. Here is the different color coded vacuotiners with different anticoagulants. First, lavender color that contains EDTA, then green, heparin, grey, fluoride, blue, sodium citrate, red, plain tube with no anticoagulant, black for oxalate. Conclusion. Anticoagulants are more commonly called as blood thinners as it prevents coagulation of blood. So EDTA, heparin, sodium citrate and sodium fluoride are some commonly used anticoagulants. Here EDTA is used routinely for hematological investigations, heparin for osmotic fragility test, sodium citrate for erythrocyte sedimentation rate by Westergren method, and plain tubes for biochemistry studies, and fluoride for estimation of blood glucose. Thank you.